All right, we're here. Good morning, Carol Johnson.
Good morning, Bob Ponte.
We had a few technical difficulties, but we're here with our weekly COVID update for Harlem Emergency Network.
Yeah, it's been an interesting week. This is what hurricane season looks like. Very uncertain weather. I don't know why I can't get my lighting straight this morning.
Mm-hmm.
A lot of chilliness in the air, dampness,
Mm-hmm.
high humidity.
Yep.
It is what it is. But this is also major when it comes to that person that was in the White House who didn't believe in global warming.
Right.
This is a perfect example of what it looks like
Mm-hmm. Yep.
because it should not be this cold, and generally it would not rain this much.
Mm-hmm.
And all the hurricanes we've already seen that a lot of people haven't even heard about.
Mm-hmm.
We've had quite a few hurricanes since hurricane season started June 1st.
Yep. Just a reminder that the other emergencies don't stop just because we had a pandemic.
Exactly. Exactly. So,
I wanted to talk a little bit about what's going on in LA because I think we need to keep an eye on this and understand that this pandemic can come roaring back at any point in time. So I'm looking at this article from the LA Times, and it says, in troubling spike, LA County sees 3,000 new coronavirus cases in 3 days. You know, and it's saying Los Angeles County has recorded more than 3,000 new cases in 3 days, part of a troubling rise in cases as viral transmission increases amongst unvaccinated people. And so this has been the first time since early March that that county recorded three consecutive days with more than 1,000 new cases. And this is all as a result of the Delta variant spreading very quickly amongst the unvaccinated people in LA County. So it's just a reminder that whatever everybody's saying, like it's going away, we're at the end of it. Well, you know, don't don't count it out so quickly.
yeah, and that's the variant is spreading across the country. That certainly um, represents the majority of the cases, new cases here.
Mm-hmm.
It's a variant is really, making a very, very bold statement. It
Mm-hmm.
popped up, it sort of was accompanied by several other variants, but there was like a battle, and then all of a sudden it just knocked all of them out the box. You
Mm-hmm.
know, and we have to remember the same way it's spiking now. When this thing started, it started over on the West Coast.
Yeah.
It
Mm-hmm.
started there, and so people was like, well, it's all the way over there. It's 3,000 miles away. And then New York became the epicenter. So,
Right.
these are the things we got to remember. Also with the traveling,
Right.
everybody's traveling now. Just got
Mm-hmm.
to be a lot more careful
Right.
about
We're
how
just
you're traveling, who you're traveling with, your route of travel, what you plan to do when you get there, where you plan to go.
mm-hmm.
And it doesn't take the fun out of it. It's just a matter of just dealing with a little more precaution.
Mm-hmm. Yep. And they're saying that about 89% of the people who tested positive for the Delta variant were either unvaccinated or partially vaccinated.
Yeah, the full dosage is important. You
Mm-hmm.
know, that was the concern in the beginning that, if people experience symptoms, they may not go back for the second one. But it is vitally important that you get both shots, unless it's the Johnson and Johnson. That's a
Right.
one shot. But and make sure you carry that card with you or a copy of it in your phone. Because
Mm-hmm.
it's still going to be places where the governor's kind of left it up in the air that if people opt not to let you in to their establishments, whether that's a restaurant or a store or, whatever type of business it may be, if they opt to not let you in because you need to show proof that you've been vaccinated, that is their right. So don't
Mm-hmm.
run around saying, well, we're going to sue somebody because they just going to take that and throw it out. So make
Mm-hmm.
sure you keep a copy of a copy of your card proving that you've been fully vaccinated.
Mm-hmm. Yep.
And it's
So
funny,
that.
I was talking to somebody and they gotten oh, that's another thing. When you get your vaccine, make sure you get the card. Because a lot of people are getting the second dose and they're not giving the cards for whatever reason. They, the workers may be overwhelmed, they may forget, but you make sure that you get that card and take it with you,
Right.
and immediately take a picture of that card once it's in your possession with both vaccinations
Mm-hmm.
um, logged in. Make sure you take a picture of it.
Yep.
So it looks like it's that 18 to 49, that age range where this
Mm-hmm.
really seems to be spreading rapidly.
Yep.
That's the age range that seemed to be out of danger in the beginning.
Mm-hmm.
That was the group was like, they're not really getting it. But then people weren't really paying attention. And very, 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 very early on, it was a 33-year-old doctor that was part of, the first people that were the medical professionals that were fighting to save lives. This guy was 33 years old
Mm-hmm.
and he died. And somebody else like 29. So it was happening, but because, we kept hearing seniors, elders, underlying illnesses, there were a lot of young people dying at the same time. And they
Mm-hmm.
fell off the radar. But right now, that is the age group. And that is also the age group that's doing a lot of moving around.
Right.
They're doing a lot of traveling. The older people's like, nah, I think I'll sit this one out. You know, we're
Mm-hmm.
not trying to hop on cruise lines, floating petri dishes.
Right. Right. Exactly.
So it's that age group that you really, really need to pay strict attention. And I don't know, I can't tell people what to do, but a cruise ship, that's just not the way to go now.
No, and did you see they had got that cruise ship up and running, and then they had to shut it right back down because of an outbreak of COVID. And it's like, is that a
Yeah.
surprise?
Amongst the workers, because people keep forgetting for some reason that you can still get COVID with the vaccine.
Mm-hmm.
And that was the crew, right? Those were members of the crew.
Right.
They got it. So it couldn't even set sail. That was its maiden voyage. It couldn't even set sail. So they
Mm-hmm.
were prepping this ship. It was this mega ship that
Mm-hmm.
was ready to go, like the love party boat. And the crew, 4 people in the crew was stricken. So again, you can still get it. Now, if
Mm-hmm.
you got the crew who's going around, who's in the rooms on a regular basis, who's feeding people, who's, bringing things to your table and talking to you and taking orders and stuff like that, that's not good. It's
Mm-hmm.
not good at all.
Not good. So I'm just checking to see if there's any other real news that we should be covering today.
I was reading an article about the anti-vaxxers,
Mm-hmm.
how the people were just cheering when I believe it was a state official who was
Yeah,
happy.
they were talking about how the Biden administration couldn't make it to the 70% level of people vaccinated, and this was at the CPAC conference,
Right,
which
see
is
that.
the conservative idiots all get together in the same room. And it's funny. It was a year ago that they had the Republican convention, and the same idiots had this this approach to things. And how many people remember Herman Cain
Dancing and
dancing and
doing the
carrying on? And
monkey and, you
there,
know,
there's
man.
there's no, it's a hoax, it's a hoax. That man was dead in like 3 weeks.
Yep. And wasn't
And
he sort of thrown into the crowd?
hmm
Where
yeah,
they
he was
up
yeah.
above the crowd and everybody was partying
Hmm.
and he died without fanfare. And that's interesting because he was once a presidential candidate. And
Right.
he died with no fanfare
He
whatsoever.
he was the Negro they loved to pull out, and then they just like they didn't even give him an acknowledgement for his service to the Republican Party. They didn't give him anything. It was just matter of fact. It was even more shameless because after he died, they were still using his Twitter account to go put more propaganda out there.
Yeah, that was, I don't wish death upon anyone.
Hmm.
But that was really, really sad.
Yes.
And right after that, you notice that those people were getting infected left and right every time
Hmm.
you turn around.
Remember about it all last year in August, like half the White House got it, and then Trump finally got it, and then they had to like rush in and give him every emergency treatment they had. You know, he had his blood levels went down. They had to rush him to Walter Reed. You know, people forget so quickly. You know.
Right, all the treatments that we weren't privy to.
Hmm.
All the treatments that the people that still love him and would still try to vote him back in if he were allowed to run.
And then those same White House folks were the first people in line to get the vaccines before anybody else got it.
Yeah,
So that's the thing that tells you. I mean, I understand why people are hesitant about vaccines because of the track records of these pharmaceuticals, the track record of this country, the track record of the CDC. I understand all that, but when you see how the moves they make, they'll lie in your face and tell you that this thing is no good for you, but then first chance they get, they're first in line to get their vaccines. You know, so you have to watch what people do, not what they say. To be able to determine their motives and to uncover what's the real truth about the situation. You know. And the truth about this situation is that each one of us is responsible for our own health. And you have to start using the actual data, not the propaganda, you know.
yeah, and it goes back to that saying, "Am I my brother's keeper?" Because that still stands where each person can infect at least four people.
Mhm.
Again, it could be close friends, it could be family members,
Right.
you know. And the thing is, everyone's just not going to tell you.
Mm-hmm.
Everybody, I've heard people actually say, "Well, I left my card home, but I've been fully vaccinated," and they weren't
Mm-hmm.
because places refused to let them in, and
Mm-hmm.
they get angry. Well, if you got it, then what's the problem with showing proof?
Mm-hmm.
Because this person wants to protect their business and their clients,
Right.
and
And
so
their personnel, you know. I
yeah,
mean, the thing that I've always, admired is, the frontline retail workers who have been throughout, day in, day out, at the store, at the cash register, risking their lives, the same as the people who work, on the subways. There's so many people who have had to, always be out there in front of the public. And then, these folks are working in stores, and then people come in and don't respect them, don't want to wear a mask, don't want to do anything. And it's appalling, you know, that you can't respect somebody else's space and somebody else's well-being. you know you're walking in because you just feel like you don't have it. You have no proof of anything, whether you have it or not, because you could be asymptomatic. You could have caught it a block before you got to the store, but these people feel so entitled that they need to walk in, and it's their God-given right to not wear a mask. There's nothing in the Bible says it's your God-given right to wear a mask or not wear a mask. So stop it.
yeah, it's really beyond
Hmm.
abominable how people are acting,
Hmm.
and you can't blame people. I mean, what is the point if we don't want to live?
Hmm.
I mean, that's the whole point. We all have the right to live, and
Right.
and still, with the underlying symptoms that might be today, but you don't know what that's going to turn into tomorrow.
Hmm.
So the Russian roulette playing with your life, that's just crazy.
Hmm.
People are like, I don't care, Oh yeah, if you get it, you'll care.
Hmm.
You'll care. Ask those 70% of the people that got it if they
Hmm.
care.
Yep.
People who can't get out of bed anymore. People who ran marathons and now they can't walk across the street because of
Hmm.
respiratory problems. People who suffer from crazy headaches, from mental distortion, almost like early onset Alzheimer's.
Hmm.
People are suffering pain in their legs, ulcer,
Hmm.
all kinds of things happening. And nobody knows how long these things are going to last. They can't get to the bottom of it. So,
Hmm.
yeah, it could be the gift that keeps on giving. And not only that, but you may not even be feeling it now down the road because a lot
Hmm.
of people weren't feeling these symptoms when they were first diagnosed.
Hmm.
Months later, they started feeling little changes. People were having problems with their eyesight. People were having, especially the sense of taste and smell,
Hmm.
you know? And then, remember there was a lot of people, myself included, who way before last October of 2019, September of 2019, the coughing fits all night. And it's funny because from time to time, I never experienced that before. And from time to time, when I'm eating something, it seems like all of a sudden, my taste buds, I can't taste it.
Hmm.
When I was having some medical problems recently, the doctor tested me again for COVID. And I had been getting tested over and over, but he tested me again. He said, "We got to test to see if it was ever in you."
Hmm.
Came back negative, but it's so noticeable that from time to time I'm like eating. I'm like, what happened? All of a sudden, my taste buds just disappeared.
Hmm.
All of a sudden, it's like I can't smell something for a brief second,
Hmm.
and I'm like, okay, I just sprayed something fragrant in my air and I could smell it. And then the next second I can't smell it.
Hmm.
It comes right back again. But he says it was never there. But you know something? The other thing is with the testing, as far as they could see. But if it was something that, I could have gotten back in October of 2019, who's to say how long that would last where it's even detectable?
Mm-hmm.
Even see if it was ever in there.
Right.
So there's a lot of unanswered questions. And as long as there's a lot of unanswered questions, we should be grateful and thankful that things are opening up to a certain degree. We're not on a complete lockdown. But if we want it to stay like that and to grow out, then we really have to pay attention now.
Mm-hmm. Yeah. So, and we're not naysayers. We want this thing to be over. There's no question about it. But we've seen too much. We saw people forget that last year the same thing happened. Summertime comes and the rates go down, and everybody's like, "Okay, we're past it. We're past it." And then when the weather got cold again, it came roaring back. And there are some who speculate that when you've got the most sun, number one, people are getting more of direct vitamin D. Their bodies deal with it better. There's supposed to be some cleansing properties with the sunlight. And so there's something, there's definitely a seasonality about this that no one has really figured out what it is. But last year they expected that there would be a surge in the fall. We talked about it for months, and people acted like we had two heads on us. And then, you know, September and October came around, and the surge, which was exacerbated by people acting stupid in August. You had that super spreader event up in South Dakota where you had the motorcycle rally, and then everybody came and then spread it to the whole region. And all of a sudden, South Dakota became the hottest spot in the planet for COVID. So the thing is that the surges, they follow human behavior. And so if you don't want to be a part of the surge, make sure you don't have that type of human behavior. It's that simple, but people just don't pay attention to that. And this is why we started off talking about LA. LA is a big city like us. They were seeing the rates go down, and then all of a sudden, it started popping up again. And so we have to continue to spread the same message. Is that we are happy that the rates are down. We're happy that people are starting to interact again and see each other again and come out. But at the same point in time, is you better keep that human behavior a certain way so that it doesn't come back and smack you in the face. And when it smacks you in the face, it smacks somebody else in your family in the face as well.
Yeah, and remember before how they were counting according to 2 weeks out from the surges, 2 weeks out from a holiday.
Mm-hmm.
Like 2 weeks after Thanksgiving, 2 weeks after Christmas, after New Year's Day. That's the way they were counting then, and they always saw surges. But now, since early July, at least, if not late June,
Mm-hmm.
Dr. Fauci was saying right now we're looking for October. He
Mm-hmm.
said if people do not pay attention in October, we can see that same surge that we saw before. And
Mm-hmm.
that speaks directly to what you was just saying.
Mm-hmm.
The summer months and as it started to get colder.
Mm-hmm.
So that's what they're looking at now.
Mm-hmm.
Um, we can prove them wrong by our actions
Mm-hmm. Yep.
or lack thereof. But this it's not a game. So let's let's just take care of each other.
Yep.
That's the key. We have to take care of each other.
That's the key.
So
I think that's all we need to say about it for today.
yeah,
Yep.
yeah. So again, as always, wash your hands frequently. wear your mask over your nose and your mouth.
Mm-hmm.
Still continue to socially distance
Mm-hmm.
best you can. Carry your card. Make sure you get your vaccine card if you've been vaccinated with
Mm-hmm.
both vaccines. Now, it doesn't matter if you only have one vaccine. If it's the Pfizer or the Moderna, and you've already had one vaccine, only one registered on that card. Well, that one doesn't matter. But once you get both of those vaccines on there, you make sure you carry it or carry a picture of it in your phone. Johnson and Johnson, one vaccine. Make sure you put a copy in your phone. And there's
Yep.
something else that you can put it in the Excelsior wallet. It's like called the Excelsior Passport.
Mm-hmm.
It's a wallet where you can store the card. And what it does is that early on, there's always scammers. They were selling the blank cards online.
Mm-hmm.
And so people were actually having their cameras in certain places, sort of taking pictures of people's cards
Mm-hmm.
and documenting it on the information on the blank cards that they did. So the passport protects that information. It doesn't put any of that information down. It gives you it lists your date of birth and the date that the vaccine expires. The expiration on the vaccine. Now that doesn't mean the vaccine expires, but they give it a year out after your second vaccine. So if you got it on March 10th, 2021, it will register in that wallet as March 10th, 2022.
Mm-hmm.
So all of your other information is protected. It'll have your name, your date of birth, and the time that vaccine will expire, which is a year after, or the information is expiring, not the vaccine. They don't know if we have to do boosters or anything,
Mm-hmm.
but that's all it gives you. So it doesn't have the numbers. It doesn't say what kind of vaccine you had, and it has your date of birth.
Mm-hmm.
So that's one way that you can actually protect the information on your card. So that's it for me.
All right. Well, that's it for me too. So stay safe, and we'll see you again next week.
Have a good week.